will pass it to you, Mary and Jenny. I know Jenny had some internet challenges earlier, so please just be patient with us if we need to do any troubleshooting.
The first troubleshooting is to unmute your microphone. Thanks so much, Michelle, for that introduction and for making the opportunity for us to come and present about our project. We're really excited about this work, and it's always nice to be able to come and present it to some folks that we know. It's good to see some familiar names and faces here, but also some folks that we don't know. So yeah, just thanks so much for the opportunity. Like Michelle said, my name is Jenny Vengris. I'm an associate professor in the School of Social Work. Before I joined the faculty, I spent a lot of time in policy work and community development work in the areas of housing and homelessness. Mary Vaccaro, who is the co-lead on this project, PhD student making her way through the program, also comes with a tremendous amount of frontline and research experience in housing and homelessness. And so that is how we come to the work and how we situate ourselves in this work. We're going to present today about a project we've been working on for a number of years, the Community University Policy Alliance on Gender-Based Homelessness. And I will say that, and this is probably common across different disciplines and faculties, that we tend to use different language to describe co-design, what you're talking about in terms of co-design. So, words like participatory or collaborative. So we'll use some of that language interchangeably through the presentation. And I would be really interested, we're a relatively small group, to have a bit of a conversation, because one of the lingering questions that I'll let you know that we're left with is, how does the idea of co-design apply to policy advocacy? It makes a lot of sense how co-design applies to sort of programmatic interventions or sort of interventions, but when we're talking about trying to change the structures that result in those interventions, how does co-design matter there? So anyway, we'll talk about that more when we get to the end of our presentation, but we'd like to give you a lot of context for what we've been doing. And we'll do the thing now where I ask Mary to switch the slide over. So here's what we plan to do: provide you with an overview of our project. We will talk about our approach to participatory policy advocacy. We'll talk about some of the things that we've actually accomplished through the project to date. And then I think we have 6 or 7 key lessons that we want to offer to you as a way of inspiring maybe some conversation with you, your own reflections as you hear us talk about this work. So we'll move to the next slide. I will say that as a presenter, sometimes I talk fast, so I invite you through the chat to slow me down if I am moving too quickly. And I think that we can be relatively conversational about this. So if anyone wants to ask a point of clarification through the presentation, don't hesitate, but we can engage in a more sort of fulsome discussion at the end. Does that sound good? Good. So Michelle gave a bit of context. I'll just expand on that a little bit. The School of Social Work back in 2018 received a really generous donation from Dr. Richard Splain. Dr. Splain was a social worker who engaged in what we call in social work macro practice. So was looking at how the systems and structures that impact people are developed, born, implemented. And one of the things that Dr. Splain noticed through the end of his career was that social work as a profession, as a tradition, as a discipline, has continued to move further and further away from its social justice and kind of policy structural roots. And this is, I teach the policy class in the School of Social Work, so I could give a whole lesson on how neoliberalism over the past 25 or 30 years has meant that our interventions as social workers have become much more about the individual and how do we change the individual in order to fit into what is, I think we all can recognize, a fundamentally broken system. So Dr. Splain was interested in how social workers engage in, participate in, and build policy responses that are more humane and that meet the needs of people. And he offered this donation to 3 different schools of social work across Canada, thinking that the place where a professional program where social workers are trained to do their work was a good place to intervene in this problem, right? So how can we apply pedagogical changes to make sure that social workers see themselves as the policy actors Richard Splain hopes we will be? Our colleague, Dr. Stephanie Baker Collins, spent some work when we first learned about this donation, thinking about how we might engage in advancing the study of social policy. And then Mary Vaccaro was hired as the coordinator and came up with some different mechanisms or tools that we might use to do that. And we made the decision to engage in what we're calling a community university policy alliance that is pretty intuitive, bringing community and academics together to work on really complex policy problems. So we wanted to lend this effort to something we saw in the community that was not getting much traction in terms of policy solutions. Next slide. And so just so that policy means a lot of things to a lot of people in different disciplines. And so we want to just articulate what we're talking about when we talk about social policy. And at its core, at its most fundamental, social policy asks us to think about what we owe each other in a society and the kind of society that we want to live in. So we had, at the beginning of our project, a lot of philosophical or theoretical debates about what we were talking about when we talked about policy. But as you'll see through our presentation, we quickly started to engage people who were working on the ground in services in the homelessness sector and realized that we needed to come up with a really kind of concrete definition of what we meant by policy if we were going to be engaging folks in this work. And so for this project, really concretely, we're talking about policy as an explicitly stated course of action. And that explicitly stated course of action either seeks to promote well-being or solve some sort of social problem. And we are situating policy for the purposes of our project in governments and organizations who do this, offer an explicitly stated course of action in order to promote well-being or solve a social problem. And they do this to govern the work, to mobilize action. And I think it's important for us to know that the impacts of that are far-reaching, right? So it's not just a dynamic between governments and organizations, that service users, that frontline workers, that managers, that organizations as a whole, that the public all are impacted by policy decisions. And so out of that is born our fundamental belief that everyone in the sector, frontline staff, managers, service users, academics, should be active actors or influencers in social policy decisions. Mary's going to talk now a bit more concretely about what we're talking about when we talk about gender-based homelessness.
So as Jenny mentioned, the Community University Policy Alliance really sought to intervene in a complex social policy issue that wasn't getting much traction in the community. And when we were having these conversations in the earlier days, we decided to intervene around an issue where we can say with some confidence that enough good research has been done. Like we don't necessarily need research to learn about what would solve this problem. And in May of the first year of the project, so 2 years ago, we had an idea or a sense that housing would be a good area to focus on in Hamilton. We knew that there were a lot of community organizations doing a lot of work around housing, and so we convened folks in senior leadership positions into a conversation where we presented a similar but yet very different model from that was happening in Australia, where a community and university were coming together to look at housing. Although that project was really different from where we ended up, it kind of provided a bit of a good context for what could be possible. And really what came out of this meeting was a bit of a call from some community leaders about a group of women and gender diverse folks who are sort of accessing very low barrier, very ad hoc emergency interventions, who don't seem to make their way into the shelter system or the housing interventions that exist in Hamilton. And so the CUPA really seeks to develop better policies for this group of women and gender diverse people. And this population doesn't have children in their care. And this population really would be considered folks who would be chronically homeless or cycling in and out of homelessness for a long time, and who experience multiple systemic barriers to being successfully housed and sheltered in the current system. So we also know that there's not a lot of data quantifying how many people would fall into this group. But we do know Carol Ann's Place, which is a program run through the YWCA and through St. Joe's Womankind, which really provides low barrier overnight services to women and to gender diverse people who can't access the shelter system because it's either full or because they're not, because they're perhaps banned from it. Has served over 400 unique service users since COVID began. So when we had this meeting in May 2 years ago, the Carol Ann's Place funding was ending because it was only a seasonal program before. So what we heard from two sort of leaders in women serving organizations in the community was that there was a need to focus on developing better policy interventions for this particular group of folks. Some of the barriers that this population experiences that are complex mental health and substance use, complex physical health concerns, and barriers to accessing care, trauma, particularly related to violence and mother-child separation from child welfare organizations, deep poverty, and criminalization. And we know that these individual barriers bump up against a system that is both under-resourced and ill-equipped to shift this. So some of these systemic barriers include, unaffordable housing, inadequate social assistance rates, mental health supports and addiction supports that are inaccessible, an emergency shelter system that relies on low staff numbers and that are very underpaid to undertake the kind of complex work that they're being asked to do. An outcomes driven system, which means, shelters get their stats and get their funding based on how many people they're housing. But what we really learned was that there's no permanent low barrier housing options that exist in Hamilton with support for this population of folks. And we use the term complex homelessness because we're really trying to talk about a group of people whose homelessness it is caused by other issues besides housing affordability, that their homelessness is long lasting, sometimes 20, 25 years, that they're well known within the system. They interact with multiple health and social service providers for the most part, but they seem still to not make much traction in terms of being able to find an intervention or a housing support that meets their needs.
So we want to talk now, so that's sort of the context. That's a fairly quick overview of a complex context for our project. And we want to talk about our approach to participatory policy advocacy through the Community University Policy Alliance. So if we can go to the next slide. So this is not a very nice slide, but it shows you the extent to which we have a really significant series of key players working on this project with us, both from the university. So I'm Jenny. Mary and I have the opportunity to lead this project. We have an internal faculty group who advises us. We built a process in which community-based organizations can identify prospective students who would receive a scholarship for a graduate diploma that we have in community engaged research and evaluation. So we have our second student through that program now who support some of the research pieces of the Community University Policy Alliance. We've hired 2 research assistants who are social work students who also have frontline experience in the shelter system. And one of the things that was key because of the goal of the project to advance the study of social policy, we really needed to make sure that we were integrating students into the project in a meaningful way so that they were learning. So we've had in social work, we have 390 hours of placement experience per the 3rd and 4th year of a student's trajectory through the BSW program. So we've had placement students, we've engaged with the research shop through the Office of Community Engagement and had a number of McPherson student partners involved in our work as well. And in terms of the community side of the CUPA, we do have 2 community co-leads, and these are the former co-chairs of a collaborative table called the Women's Housing Planning Collaborative. This is the leadership table, and they really helped advise us when the project began. They were our only community partners at the very beginning, and so we've expanded a lot since then, and they continue to advise us in a more sort of distant way now. We hired 2 policy consultants, and so these are both women with lived experience of complex homelessness, fairly recent experiences of complex homelessness, who work with us on our small project team and advise every step of our work. We also have a policy to practice working group, which I'll talk about a bit more in a couple of slides, or the next slide, which is comprised of people who work on the ground, either in organizations or in grassroots mobilizing efforts, who, again, we consult with and they advise us on our work. And then we also participate in a couple of different community tables, including the Women's Housing Planning Collaborative and a subcommittee to the City of Hamilton. We've recently been invited to Hamilton Health Team Planning. So we're trying to find our way into lots of different community conversations about this particular issue. So those are key players. Probably the most important, if I could, part of our work is our working group. And so our process is guided by this working group, which includes frontline workers, people with lived experience, service managers, and grassroots organizations. And I think that, this is really Mary who brought this analysis to our project early on. And we'll talk about this a little bit further, but I've been working in policy for a long time, and policy tends to be the domain of people with institutionally situated power to make decisions. And so it was really important in this work that we hear from people who are impacted most directly by the policy decisions that are being made in terms of housing and homelessness at the municipal, provincial, and federal levels. So this working group has been central to our work. Our working group really focuses on bridging the connection between policy and practice. So connecting our work and the ideas that are emerging to what is actually happening on the front lines, which has helped us shape our project, the direction of our project and our advocacy goals. And one of the things that is common across a lot of different participatory processes, and that does not always fit well within academia, is when you do invite a robust kind of community involvement in your project, it does mean that things will shift and change. We'll talk about this in our lessons learned, but just to say that it was a bit of a daunting process at the beginning to hand as much influence as we did over to people who were not Mary and I, because I think if you saw our work plan 2 years ago versus our work plan now, it looks wildly different. I think Mary, I'm going to talk about this, people with lived experience. So we had an ethic coming into this project around centering the voice of people with lived experience of complex homelessness. And then COVID-19 hit, and it made everything much more complicated in the work. And it meant that we were not able to engage in in-person meetings. And the reality of the group of people that we're talking about who are accessing these ad hoc drop-in services meant that setting up Zoom meetings, for example, would be tremendously difficult. I mean, I think that Mary now, with the insight from the CUPA and her own creativity, has found a way through her dissertation work to make this happen. But in the very beginning, the idea of, we had anticipated that we would go to these drop-in spaces with art supplies and engage in kind of low barrier informal conversations. And COVID-19 really impacted that in a significant way. We did hire 2 women, like I said, Farron and Megan, who have consulted our project at every step. They are paid members of our project team. And we did have to do some troubleshooting in the beginning around technology and participation. And we can talk a little bit about what we've learned through that process. And so we have worried, I think, since the beginning about how little people with lived experience have been invited explicitly into our project. We'd imagined much more involvement. And one of the things that we do recognize is that Mary worked on a project before your PhD, right, Mary? Called The Invisible Study, and an emerging study that's coming out around women envisioning supportive housing. And so a lot of the cues that we take about next steps come from the consultation that's already happened with the group of women that we're talking about. And then really what this has meant, what all of this involvement has meant, particularly the fact that we've had really kind of like grounded grassroots involvement, it has signaled to us the extent to which these folks have been disconnected from decision-making conversations about the interventions that are required in terms of this complicated situation. So women and gender diverse people. I just want to make a note here because this is something that we've struggled with a little bit. For those of you who don't know, our homelessness system is separated into the gender binary. So we've got men's services and women's services. And what it has meant is that people who identify or people who are trans or non-binary oftentimes access the women's system because it's safer. And so we just want to be clear that our project does not include a robust analysis around gender diversity, but instead focuses on the women's system and the people who access, people who are non-binary and trans tend to also access that system. And so a big part of our work, and I don't think, Mary, that we anticipated this, that a big part of our work has just been about calling attention to this group of people. So I think that we came into the system thinking that this was already a significant priority. And it seems like we've spent a long time continuing to name this as an issue. And so we've done that in a couple of different ways, delegations to City Council. We wrote an op-ed in The Spectator back in December. Excuse me. And every time we go to a local decision-making table or planning table, we continue to talk about this issue.
So now I'm going to spend a little bit of time highlighting some of the work that we've been doing over the past few years of the CUPA. So as we mentioned, COVID kind of hit midway through the pandemic or midway through the project, and it shifted our work in a number of ways. We knew that the COVID-19 pandemic was going to have a really significant impact on housing and homelessness serving organizations, particularly shelters and the drop-in programs that we were connected to. So we did go to our community co-leads and sort of ask them what they wanted us to do. And we actually at that point offered to pause the work. We knew that they were going to be so busy with dealing with everything on the ground. We didn't want to take up their time unnecessarily, or if things were kind of pausing or shifting. But what was interesting is our community partners asked us to do a research study. And like we said at the beginning, we initially hadn't planned to do research. So they asked us to do a research study, and they asked us to focus on the unique ways that COVID was impacting both women and gender diverse people who were experiencing homelessness, as well as the frontline workers and the organizations themselves. And we engaged in interviews, and we learned a few key important lessons. We learned that COVID was exacerbating existing vulnerabilities for this population. So we heard that, violence against women was increasing. We heard that substance use and overdoses were increasing within shelter spaces. We heard that mental health outcomes were also decreasing, like people were just not doing well. And we heard that for folks who had recently transitioned out of homelessness, the isolation was particularly difficult. What we also learned is that, so during the pandemic, there was a number of interventions put in place to help with physical distancing in shelters. Unfortunately, what we learned was that a lot of these interventions really weren't designed to meaningfully support those with the most complex service needs. So this meant the folks in the group of people that our project was concerned about were still left accessing these ad hoc interventions, largely without the ability to shelter in place. So there's a day program and a night program. They're on, I would want to say opposite ends of the city, but they do require a bus ride to get back and forth. So this group of people who were accessing these programs were still taking the bus twice a day without the ability really to shelter in place or to follow the public health guidance at the beginning of the pandemic. And we heard from frontline staff directly that they were not feeling well supported in their complex daily work. What we found was that as these new interventions opened up, people who were more stable and able to maintain were kind of put into new interventions, which meant that these ad hoc services were dealing with people with the most complex needs all in one space. And so we were able to publish on our research, and we were able to share our lessons learned with community partners. Our main goal, really, through the work of the CUPA, is to advance the development of low barrier, permanent, gender-specific housing. And we try to do this through both policy advocacy and policy reform. So building on some of the research I've done and some models of housing and support that exist in other parts of Canada, we really envision a place-based model of housing that would offer folks living there with an array of on-site supports. So this might include meaningful harm reduction support for people who use drugs, low barrier access to healthcare services, including mental health services and physical health services. And we also imagine that it would have a robust peer leadership and community component built into the housing. Um, this echoes what we know women and gender diverse people experiencing complex homelessness in Hamilton identify as their preferred housing solution. Um, I was able to do a project with the WIPIC in 2017 where we spoke to 75 women experiencing chronic homelessness, and that's really what we heard, that people that loneliness and isolation was a key barrier preventing people from cycling out of homelessness, and that people actually wanted to live somewhere that had intentional community, on-site supports, and an array of kind of low barrier access to the services and supports they need. So we are really advancing this work in two ways. One is through a pragmatic housing guide, and the second one is through advocacy in the residential care facility system in Hamilton. So our first one is this low barrier gender specific housing guide. So it's a policy and practice guide. And we, in collaboration with the working group and with our policy consultants, are in the process of writing a document that recommends pragmatic ways that policymakers, funders, housing developers can take complex concepts and integrate them into housing that would work to meet the needs of women who experience the most complex forms of homelessness. So the document will be ready and released in September. But just a few things that we're focusing on. So we have continually heard from decision makers that in order to do that, to operationalize this kind of housing, we need strong partnerships between housing and health sectors. So we have a section talking about building partnerships and what kind of partnerships would work. We talk about harm reduction in housing. What we do know for sure is that there's no housing model in Hamilton or shelter that explicitly supports people who are actively using drugs. And substance use is a huge barrier to both maintaining an emergency shelter bed in the city. So we're talking about how we can integrate harm reduction meaningfully into housing, what low barrier access to housing would look like. We worked with the research shop and they put together, so a group of students put together a really beautiful report around trauma-informed architecture and trauma-informed infrastructure. So we'll be folding that in. Thinking about community and peer support, we held a special workshop inviting a bunch of peer support workers together to talk about what peer leadership, what paid peer work could look like in a housing program. And then we will be building in a bit of a policy analysis, particularly about how policy keeps people homeless and how the broader policy realm has contributed to these issues of complex homelessness for this particular population. And the second kind of key area in which we do our advocacy is around the residential care facility system in Hamilton. So the residential care facility system in Hamilton gets a lot of publicity, particularly a lot of news articles in the Spectator. But we do believe that the RCF system is an important piece of our project, and we remain committed to being involved in the city's process and commitment to reimagine the RCF system. As it currently exists, the majority of RCFs are operated by for-profit operators. And so we believe that if this system could shift into the non-for-profit sector, be operated by the organizations that are already committed to and serving these folks, that it could provide the kind of communal environment, high level of support and care and housing that might be able to sustainably house the people that our project is focused on. So we're hosting an RCF summit. This is going to be bringing together interested stakeholders from the community and from the university. And we've done this in partnership with the Hamilton Roundtable for Poverty Reduction and the RCF Tenants Coalition. So we're doing that on June 10th. And really, it's going to be an opportunity to talk about the potential promises that this system could have for people who aren't able to kind of, who haven't been successfully housed in other interventions right now. And we're really hoping that the summit will result in both new partnerships and document in a document that will outline how the RCF model could be both better folded into the existing housing and supports services in Hamilton and meet the needs of this population of women and gender diverse folks.
So Mary and I are going to share some of our key lessons that we have learned through this project, and we will wrap up with enough time, so that we can do some Q&A, because I'd love to hear your reflections on what we've offered today. So the first lesson, if you can move to that slide, Mary, is around relationships, trust, and intuitive decision-making as central to this work. So I have the privilege of having worked in policy for a while. I was a senior policy analyst for the city of Hamilton for 5 years during the creation of our Housing and Homelessness Action Plan, our 10-year plan to end homelessness. And one of the things that I learned doing that policy work was the extent to which policy decisions are made based on, or at least the framing, that policy decisions are made based on objective, empirical decision making. And that always felt a bit off to me, because while policymakers say that what they do when they make policy is they consult the data, they take their own kind of values and perspectives out of it. That never kind of sat well for me, probably because my orientation is as a social worker. So coming into this, I think we've had more latitude to really explore the extent to which that relationships, trust building, and our own intuition is central to policy advocacy work. So Mary and I mentioned that we both have extensive history working in the housing and homelessness sector. We came into this project with a lot of relationships already kind of deeply built. We have built new relationships through this work, and it has really been so important to the gains that we've made. And we really are starting to see the possibility that new forms of housing might be built, the possibility that decision makers are paying keen attention to the issue that's emerging from this project. And that is not because we've presented compelling data. There is no data in this sector. The reason is because we've built strong relationships, built trust in the sector, and used our own kind of strategic intuition in this work. We also know how policy works, how policy making works in Hamilton. We know the kind of different players and how the municipal, provincial, and federal governments intersect. So it was really important for us to kind of have that grounded understanding, but then to layer on top of it this idea of kind of like relationship, trust, and intuition in our work. We can go to the next lesson. The other thing that I think we really learned through the 2 years that we have been working on this project is that to engage with community is to be responsive to the emergent needs as they come up. And so we've had to be really flexible, and our work plan as a result is always changing and evolving. As Mary said, when COVID-19 became a really significant crisis in our community, we suggested to our community partners that we stop, and they said, no, this is exactly when we need your sort of focused attention. And so I will say that the context in which we're operating, this donation from Dr. Richard Splain, which is not through a particular funding body that has really clear outcomes attached to it, has meant that there is a tremendous amount of flexibility to pivot as needed when things emerge in the community. So for example, a community partner, Medora Uppel, who we both respect tremendously, was having important community conversations about the reality that she was witnessing and people in the sector were witnessing, that through COVID-19, for whatever reason, the number of people experiencing pregnancy or reproductive crises, really, whether that be miscarriage or not having the opportunity to really rest after an abortion, for example, was coming to the fore in the sector, and so was really calling attention to this. And so we had the opportunity to partner with the YWCA and the community research platform through the Faculty of Social Sciences to convene a call to action forum a couple of weeks ago that brought together 50 community partners to try to develop local responses to this issue, right? So we were able in this project to be flexible and lend attention and support to that process. And that was important in terms of the previous slide, continuing to build trust and relationships in the community.
Another key lesson that we learned is that advocacy is slow moving, strategic, and thoughtful. This was a particularly hard lesson for me to learn. I've spent about 8 years working frontline in the emergency shelter system, and it has been difficult to move at the pace that we're moving because the solution is so clear. Like, there needs to be the development of this kind of housing. It's been also difficult, working with the working group, who are largely frontline workers who are doing this work day in, day out, and also have this sense of urgency. But we've learned that it's a slow process, that it has to be strategic, it has to be responsive, and it has to be thoughtful. And we also spend a lot of time thinking about the tensions within and the opportunities for balancing sort of relational and adversarial approaches to advocacy. So we know two things. We know the system requires critique, and we know there is an urgency for the need for change, but we also know that change requires trust and change requires relationships. And so we've been very thoughtful in our approaches. We've been thoughtful in our process, and we've really tried to prioritize relationship building, and ensure that people have trust in our process before just sort of steaming ahead. And this is for me?
Yeah.
Okay. And we also know that advocacy involves advocating within and outside the service sector. So this was a pretty key lesson learned in our project. Originally, we kind of imagined that our advocacy work would focus on policy change at the municipal, provincial, and federal level. I remember early days having conversations about mapping out all this different, like mapping out the policies that were impacting this population and kind of seeing where we could intervene and where advocacy would be best focused. As we sort of got into the work, we got more embedded with the community. We got invited to more tables. We started realizing that we are actually spending a lot of time advocating within the sector. We really try to ensure that the needs of this population are being prioritized in local systems planning. And, for lots of complicated reasons, this population of women and of gender diverse people don't always make their way into these services. If services that are outcomes driven, someone who's been homeless for 25 years isn't going to give you a good stat or a good outcome. Policies around substance use within shelters prevent people from even getting in the door. And so we've spent a lot of time thinking about larger municipal, provincial, and federal level policy change, but also just advocating, at the various tables and systems that we do get invited to. And then we also have spent, like, as Jenny was mentioning at the beginning, we both come into this work with with an ethical commitment to really involve and prioritize the perspectives of people with lived experience. But we know that this is complicated, and it was made even more complicated during COVID. The way that we could have seen ourselves doing this kind of engagement was no longer possible. We couldn't just drop into spaces like Willow's Place and Carol Ann's Place and have informal conversations with service users. We also didn't want to set up a system or a process that was so out of touch and so not feasible for both the people we were trying to engage and for the frontline workers who were in the middle of a pandemic and had enough going on and really probably didn't have the capacity to support us to do this work virtually as well. So in doing this, we had to really rely on the expertise of our policy consultants. We had to rely on existing local community-based and participatory research, and we had to rely on the knowledge of frontline workers. But we are going to be doing this project for another year, and fingers crossed, we are hoping that COVID will lift and that we'll be able to do this work in the ways that we had originally envisioned it.
So our last two lessons are really about the kind of policy advocacy piece, and Unexpected voices have critical contributions to community planning and advocacy work. So we know, and I've mentioned this, the typical community planning processes tend to engage people with institutionally situated power, but our process has centered the voice of frontline staff and then to some extent people with lived experience. And I really think, having worked in the housing and homelessness sector for 20 years, that this has led to richer, more relevant, and more effective end product in terms of particularly the guide. Like, I think the guide is actually going to be, maybe I'm an optimist, but I think the guide is actually going to be a useful tool for decision makers to engage in new housing developments. And I think the other thing, and I'll speak for myself because I haven't worked frontline in the homelessness system, the relationship that I've built with frontline staff and with women with experience gives me a sort of urgency with which I speak at these different kind of planning tables. So I am afforded power by virtue of a lot of things, not the least of which is my position as a professor in a university, the color of my skin, my socioeconomic status, all of those things afford me power. And so how can I use the power that I'm afforded to be able to bring a real sense of urgency, which has been offered to me from the voices that we've centered, which is primarily frontline staff and people with experience. I don't think I could have anticipated when Mary came up with the idea that we develop a working group of frontline staff. I don't think I could have anticipated how central that would be to the success that we're finding now. And then our last lesson learned is that I think that we are still in the process of learning about the applicability of, co-design principles in complex policy change. So we're interested in continuing to kind of think about the experience of our CUPA and how we can replicate and scale our approach that we've taken to bigger policy arenas that impact structurally vulnerable people. So this makes a lot of sense on this relatively small but important problem, complex problem that we focused on in this sector within our hyper local kind of place. How do we take the approach that we've developed? Is it possible to scale it? Can we actually lend it to bigger policy problems? And policy advocacy often works to meet, I think what we've done is kind of turned policy advocacy on its head a little bit. So my understanding of policy advocacy from being on both sides of policy advocacy is that oftentimes what happens in that dynamic is people work to meet policymakers and decision makers where they're at. So bringing the kind of data, bringing the cost benefit analysis. And I think that what we've done in this project is engaged people who live and work in the homelessness sector to build pragmatic solutions first, and then to use those pragmatic solutions to identify what really needs to change in terms of policy. So instead of doing it sort of top down, I think what we've been doing it is in a more grassroots way, but this is kind of new analysis for us that we're still working through. Those are our lessons learned. That's the project we've been working on. We would love to maybe stop sharing our screen now and see if folks have questions or reflections from what we've talked about today. Oh, Mike Desjardins. It's good to see you.
Hi, Jenny. Good to see you too. So thank you for this presentation because is she still on here? Jillian, she might have gone off. Anyway, we're working with Jillian Mulvale to look at social prescription right now. And we've been thinking of it really from a very tangible lens, right? Like some kind of project intervention, all action focused. But I really like this approach because you're still using the co-design process of diverging and then converging. That's really all that it's about. And you're applying it to the policy level. And I think that there are opportunities. So, social prescription as a concept is really just to tackle the issue that the healthcare system is broken. It's a complex issue.
Right.
And so if we can't we're having a hard time tackling a specific manageable action, maybe the opportunity here is to look at it from the same approach that you've done at the policy level. So I'm really excited to kind of flip my brain a little bit on this and still be able to use all of those tools that come with co-design, but apply them to the policy level. So thank you for sharing your example.
That's great. And I mean, we gave a pretty quick overview of a complex project, so we'd be happy to meet. Mike and I, can I just say, Mike and I have worked together for 20 years, so it's good to see you, Mike.
And I would love to get more information.
Yeah, great. Any other questions, comments, reflections?
Was reflecting as I was listening to both of you on how I can't imagine two people who are more perfectly placed to be doing the kind of work that you're doing. Jenny, with your policy background, and Mary with your frontline experience. But it struck me that it also allows you to sort of straddle between different worlds, and that there's tensions between those worlds. So some of them were around the evidence typically used by policymakers, something that's, you know, objective and empirical, and you're bringing this other lived experience to that. But then on the front line, the timing and the urgency of the need to move quickly, and policy doesn't move quickly. So I'm wondering how you wrestle with those things and manage to stay sort of connected and authentic in both of those worlds.
That's such a good question, and one that we are like in the middle, I think, of grappling with or continuing to identify. Mary, I feel like you have more to lose. Like Mary has a lot more credibility in the like on the ground in lots of ways, though. You still are very connected to the front line who are saying like, we need change immediately. So do you want to talk a little bit about what it feels like to be shepherding a complex process while holding attentive to those relationships?
Sure. Yeah, that is a really good question. And I think it's something that we often talk about in lots of ways when Jenny and I are just debriefing or talking about the project. You know, I think the way I sort of see it is I am hopeful that something will come out of this. And I am not unrealistic that it does take time. So we are having like lots of really good conversations and that make me feel like, you know what, maybe something really good could come from this project that's more than just like, you know, some publications or some like academic stuff. I think that it could have actually impact you know, the group of women and gender diverse people that we're really concerned about. So I think that's kind of how I maintain the hope. And it's also been really, you know, the working group, we were talking about it the other day, like the fact that our turnouts are consistently good and we're hearing about how burnt out and tired and exhausted people are working the pandemic, midnight shifts and everything else in low paying emergency shelter work, but that they're coming to this and they're engaged in it, just shows that people are trusting the process as well, and that people are feeling heard or feeling like, you know, maybe that this could, you know, frontline workers are so rarely invited into planning conversations. So I think that helps. The engagement from them, I think, also helps. I'm not sure if that answered the question, but.
I think too, we're really fortunate that Mary and I ended up in this project together, right? Like, I think that we work really well together and I think we hold each other accountable. You know, I think that Mary can push me in moments when we do need to move faster or with more urgency. And I think that I can offer a bit of like a sober second thought about a moment where we maybe shouldn't go guns a-blazing to the media, right? Like, so I think that we've done a really nice job of balancing each other. And so that requires like relationship building and trust between the two of us as well, to know that when I say slow down, it's not because I don't care about people. And when Mary says speed up, it's not because she thinks I'm a sellout, like that we really balance each other well, I think too.
Hearing that trust and relationship building piece is sort of foundational. So because the messaging is coming from you to either side of this bridge, I think it's probably received better than if it came from somebody without those existing relationships.
Yeah, the fact that you have consistently high numbers coming to your frontline workers groups shows that it's you they trust. So the relationship building is with you, which means that you're doing a really good job. So congratulations. Can I also ask a question? I think it was Jenny said that she's afforded power through privilege, like the color of your skin and the fact that you're a university professor. But do you think that you're also afforded power when you're at high level meetings, that those that you engage with, like this frontline service providers and the women who have spoken to you with a lived experience, that has given you power as well, being able to speak on their behalf?
Oh, for sure. That's like a tremendous both privilege and responsibility to be trusted to carry that message to those decision-making tables. And my preference would be that people have access to those halls of power instead themselves. But yeah, I have learned, you know, I worked in homelessness for 15 years, 20 years before this, and I've learned a ton through this project and trying to stay like humble to that learning and trying to be humble in each of those places. That's hard to do. That's hard to do. And I think that's part of it as well. But yeah, I feel a lot of privilege in being afforded the opportunity to carry those messages forward for sure.
Can I ask a question? A really interesting point that you made. I'm part of the co-design hub team, and we actually just had a meeting before this thinking about the relationship between the co-design process and broader system change in terms of the inclusion of service users and service providers and policymakers together to as ultimately, you know, amplify the voices of people with lived experience in the services, you know, intended for them. And along with that is the need to address sort of institutional barriers and policymakers around that sort of thing. And so when you, I like the critical lens that you bring to your work. And what I found really interesting was I've heard in other projects I've been a part of trying to promote policy system level change that we need to meet those in power where they're at and not doing that. And I was just wondering if you could unpack that a little bit, because I think that that is really interesting. And I'm wondering about the success for that, because it's something that, like, I get it when I hear it, but it irks me a little bit because I'm like, how does that mean that we might be bending away from what people on the ground really need and want to meet the needs of those in power? So anyway, if you could talk a little bit more about that, I'd be really interested in learning about it.
Other than saying I too share this sort of like squeamish, you know, feeling of how far do you bend to what, I mean, this is just such a complicated tension. Like, how far do you bend to what decision makers need in order to see the possibility of change? How far away do you bend from the like grounded stuff that you learn from the people I share a squeamishness with? I don't know if I share like an answer about how to do that ethically and well. I don't know. Mary, do you have thoughts about that?
One example that comes to mind, and certainly it's more of an anecdote rather than an answer to your question, but one thing that we've consistently heard is that they need numbers, they need data, and that data needs to be in the form of numbers. And we have pushed back at that and let them know that, like, there is no data in the sense that, you know, these women are accessing different spaces, sometimes living in encampments, sometimes accessing services with different names. Like, there's actually no way to quantify it. So what we've done instead is, the solution is low barrier housing. Not sure if it like necessarily matters if how many women this is. We do know that there's been 400 unique accessing the low barrier program through the Y. And so instead of focusing on that kind of research, we've developed our guide, which is, you know, useful, hopefully, in its own way, and talks more about the solution than the problem.
Can you're all frozen. Am I frozen?
No, you're not.
You can hear me? Okay. I would like to delve, Alexis, deeper into this when we have a bit of like breathing room. It feels like right now there's so much urgency around the planning process, and there seems to be some attention to this particular issue right now that it feels like we don't have the time to kind of sit back and really kind of inquire at each step what we've done, how we've held true to the kind of like to the ethics that we've promised to the working group. Like, I don't know that we've done enough reflection to be able to answer your question with a ton of clarity, but it is something that is like so clearly right in front of us to explore and examine once we have a moment to do that.
Yeah, I think that's interesting. And I find that sometimes policymakers will fall back on the need for numbers because so many people aren't counted in census. And that's their way out of having to do things. And you just almost want to walk them over to, you know, an encampment somewhere and be like, here. I'm wondering if the way to show numbers and thinking about advocacy and what advocates might say too is like, how do we, you know, protest here and show ourselves in some way? And so anyway, it's a long conversation, but thanks for sharing.
I'm just gonna hop in and say thank you both for sharing and joining us today. We are right at 12:30. So I think we should wrap up. I'm going to post our evaluation link in the chat and just ways that you can stay connected with us. But we really appreciate you being here and sharing all of this work with us today. Thank you.
Thanks for the opportunity and for the great questions. It was really good to connect with all of you.
So inspiring. Thank you.
Thank you. Bye.
Thank you.